Hi everyone, I'm Stephen Lecce. I'm Ontario's Minister of Education, and it's great to be joined by Dr. David Williams, Ontario's Chief Medical Officer of Health. Dr. Williams, you have provided advice and guidance to the province and the government throughout this pandemic, and one of the main messages you've really drove home is the importance of getting the fundamentals right when it comes to following public health advice. So I thought maybe there's an opportunity to speak directly to students to say how they can keep themselves and their parents and grandparents safe throughout the fall.
Well, it's a really good point because we've done this all the way through. It's infection prevention control. It's like a classroom for our children to learn. Some are already pretty good at it already. We've known in the past when we've had our school programs on smoking and other health things, they're very good at taking up the information and being very vigilant and following it. So this is an opportunity for them to do infection prevention control. That means they know that when they're coming to school, they have the distancing from each other. They have the masking when they're in public places. They wear them when they're supposed to wear them all the time. Wash their hands, hand hygiene, and to make sure if they're not feeling well, to talk to their parents before they come in, and to stay home if they're sick and that. They're learning how to be infection prevention practitioners in a way. They know what the infectious diseases, how they transmit. It's not magical, it's very biological. And this is a good learning laboratory, if you may, for them to do that and to practice that, because the better they do that in the school, the more likely and for sure that they're not going to bring it home with them. They're not going to contract it. They're not going to bring it home to their family members, some of whom may be older or have health conditions that they want to protect them from. So they know that. And we want them to be practicing, doing it again, and being consistent. And some are very good ambassadors in that regard, reminding the public what they need to do. So they take the messages very seriously. So we're looking forward to this learning experience for our children, not out of any fear, apprehension. They know what it is, they know how to handle it, they know how to protect themselves and their family, and we want to give them this opportunity to learn about it, but experience learning back again. They love to be at school.
Amazing. So do your part, follow the doctor's advice, and we wish you all a very positive restart in September.